Hello, PsyQ community, and welcome to today's webinar entitled Psychiatry Perspectives on Patient Care in a Post-Pandemic World. My name is Phillip Lai, and I'm a medical science liaison with Otsuka Pharmaceutical Development Commercialization. I'm excited to welcome back our speakers, Dr. Richard Weisler and Allan Chrisman. Dr. Richard Weisler has had a psychiatric practice since 1980, where he and his team follow more than 2,000 patients with a mixture of psychiatric conditions. He's also a board-certified psychiatrist, as well as adjunct professor at the University of North Carolina School of Medicine, where he served for many years as the chairman of the Board of Visitors for the Department of Psychiatry. In addition, he's an adjunct professor of psychiatry and behavioral sciences at Duke University Medical Center. Dr. Chrisman is an associate professor emeritus at Duke University School of Medicine. In his 40 years of practice in both adult and child psychiatry, he's worked in a variety of settings, including inpatient, residential, outpatient, and practiced for 13 and a half years at the Harvard Community Health Plan as a consultant to both pediatric and internal medicine practices. He's had a number of leadership positions, including the chief of 2 mental health departments at the Harvard Community Health Plan. Since retiring, he's pursued his interest in disaster mental health and works with the Red Cross in their disaster health services, as well as disaster mental health. Today's presentation is brought to you by PsyQ, a collaboration between Otsuka Pharmaceutical Development and Commercialization, Inc., as well as Lundbeck LLC. Our speakers today are paid consultants, and I am an employee of Otsuka Pharmaceuticals.
So we're now going to be talking about managing mental health during COVID-19. This will be a joint session between Dr. Weisler and myself. The frame for this area of emphasis is going to be community resilience. And community resilience really speaks to the capacity to a community to prevent, withstand, respond, and to recover from disruption, and to utilize knowledge from disaster planning to identify and help communities at risk. A healthy community is one in which a diverse group of stakeholders collaborate to use expertise and local knowledge to create a community that is socially and physically conducive to health. In the Triangle area of North Carolina, we have a partnership called the Triangle Regional Resilience Partnership that was supported by a grant from the state. And this was to identify socially vulnerable populations that are disproportionately affected by stressors and impacts to health. The importance here is that in the town of Chapel Hill, as an example, in the surrounding Orange and Durham counties, we have actually gone and mapped out physically those areas that are most vulnerable to areas such as flooding and other disaster-related events. It turns out that those areas also are most vulnerable to the pandemic, and the health inequities that we referred to earlier are also highlighted when the pandemic hit. And so this prior planning and mapping out allowed us to anticipate the need to allocate resources more actively, proactively in an advocacy way to actually mitigate and reduce the impact of the COVID infection rate. And I know that for a fact in my town of Chapel Hill, the historic African-American community, which is very tightly knit, was able to be very successful with the town, help get adequate supplies and to look out for each other. And so even the process of identification and tracking of infection rate in that community and prevention was greatly increased and continues to be a benefit to this day.
Okay, so what I want to do here is talk about suicide risk and prevention during a pandemic, and this is obviously a critical topic. And so in the first section over there, you can see the experience of a suicidal crisis, and that's something we definitely need to be very aware of and need to make sure people have access to assessments. There are crisis helplines, and again, there's a national number that people can call if they feel suicidal as well, and then make sure that we have government provided resources as well as hospital and clinical resources. Now, mental illness clearly increases the risk for a lot of those things in that first section we were just talking about. But we want to realize that care deliveries are going to have to be a little bit different. We'll have to modify, as we talked about, using some of the telehealth, et cetera, approaches, and the government needs to assist us with that as well. The government, again, needs to monitor intake and reminders on safe drinking, and we need to do that as well because there's been a huge increase in alcohol consumption as well as other drugs during this time, including the opioids, and that can make clinical conditions much worse as well. financial stressors on everybody, including the government, as noted here. So we need to make sure there's longer-term planning. Now, as far as access to means, this is what Allan talked about earlier as well. We need to be very aware about people buying guns if they're already depressed or having drug or alcohol issues, and to monitor that carefully and make sure that we limit that. And domestic violence is clearly going up in a lot of areas as well. And I would also add, domestic violence to me would also include violence against children. And that can be a problem too that we need to ask about and be sure that's not happening and do something about that. Now, media professionals, people are watching so much news, and it can have a really positive effect sometimes on how people handle things, but a lot of times it's negative, and the irresponsible media reporting, poor coverage, particularly with nothing positive or suggestive about how you might deal with it, can make things worse for people. And then that final group over there, that isolation, entrapment, loneliness, and don't forget bereavement. I was just talking to a health provider at a nursing home where the nursing home had had 34 deaths. And so the staff were having to deal with all that as well. But again, help those in the community living alone, friends and family. We need government support in that also. So again, be aware there's services. And here's some prevention opportunities. So I think that first bullet is an important one. Physical distance, but not social distance. Again, we want to still be connected with those we love and care about, friends, family. Again, the telemental health that we've talked about at some length already can be quite critical and give a lot of people support. I still think we are in this area, we don't have enough mental health providers. We need to train more people to provide. And again, that distance-based suicide prevention, whether it be the hotlines or other kind of numbers that you can see here, or reach out to somebody at the hospital or church or school, wherever people are at, can be very important. The media reporting about hopefully some of the positive things about how do you access care, what things might be helpful, can be very important. And then the bottom bullet, I think, is also very important, which is lethal means restrictions. You know, it's a little bit trickier now because a lot of times we're being forced to prescribe larger and larger amounts of medications because people have a hard time getting to the pharmacies. But you have to be aware, somebody has it, you are worried about suicide, it's not a good idea to give a 90-day supply potentially of certain types of medications. But we also need to be aware of guns and ask about things like that too. And a lot of times it may mean have them give them to a family member or somebody else for safekeeping. But again, if you've got someone you know or you know there's a crisis call, that suicide prevention hotline and lifeline is there 24 hours a day, 7 days a week, and there's no charge for that one.
So I'm going to step in here at this point to emphasize that there are resources for healthcare and community leaders, and this goes again with the theme here of community resilience. The American Psychiatric Association has an excellent COVID resource webpage, and on it they have an area where they've improved the kind of messaging that would be available to healthcare and community leaders. And so you'll easily access this on the internet by going to the American Psychiatric Association webpage. But I want to emphasize within that are other resources that you can access. So again, we're looking here at trying to give people a consistent national message about employee mental health and well-being during COVID, the emphasis on how to work remotely during COVID so that your mental health and well-being are in fact looked after. The Center for the Study of Traumatic Stress has excellent resources, including messaging for grief leadership, which is critical during COVID-19 for the healthcare workforce and for the community. And then looking at how public health leaders can support communities during quarantine time. So we are really fortunate to have, again, this list of resources that are available, and they address topics that are deemed to be critical issues related to resilience and the successful mitigation that we're looking for with the stress of COVID-19.